Did you know that Tylenol and Motrin can actually be taken at the same time? That's right. This is for many people, probably not everyone, but many people can take them at the same time. It's because these two medications are different, they work differently, and they also do slightly different things in the body. Guys, we're talking about the differences between Tylenol and Motrin. One big difference that you're going to want to stick around and hear, this is super, super important. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Now, when we talk about Tylenol, the brand, that's the brand name, by the way. The generic name is acetaminophen, okay? Of course, these are the terms in the US. They might be different throughout the world. When we talk about Motrin, that's a brand name. The generic name is Ibuprofen, but that also fits the category of naproxen, naproxen, Advil, etc. Now, there are certain people who should not take Tylenol and certain people who should not take Motrin. For Tylenol, if you are a drinker, drinking alcohol, you may not be able to take Tylenol. It might be potentially harmful for you. If you have liver disease, you may not be able to take Tylenol either. It might be harmful for you. Also, potentially kidney disease. And again, there's a longer list, but those are some highlights. Your doctor would be and is the one to tell you what you can take. When it comes to Motrin or Ibuprofen or Advil, Aleve, all those, there are some people who shouldn't and can't take these medications. Number one, if you get stomach upset or have stomach issues, stomach ulcers or other things, you may not be able to take ibuprofen. If you have heart conditions, certain heart conditions, your doctor may not want you taking this. If you have kidney disease, this may not be the medication for you. I'd also add to that medications like ibuprofen, Advil sometimes can raise blood pressure in some people if used long enough and at high enough doses. So if you have high blood pressure that's hard to control or high blood pressure period, your doctor may not want you to take Advil or Motrin. Again, you got to check with them. I would also say if you have bleeding issues, whether you're on blood thinners or something else is going on, you may also not be able to take ibuprofen. Again, this is sort of a cheat sheet, a very short list, but those are some things to keep in mind. Now, let me tell you the one big thing that I need you to know in terms of the difference between Tylenol and Motrin, okay? And it comes down to what they fix, what they solve. So let's break it down. Fever. Does Tylenol fix fever? Yes. Does Motrin fix fever? Yes. All right, they both do that. Let's talk about pain. Does Tylenol fix pain? Yes. Does Motrin fix pain? Yes. Now let's talk about inflammation. Inflammation can be caused by a number of things, from you have arthritis in your joints to you got injured somehow or what have you. Sometimes swelling and redness are signs of inflammation, but that doesn't have to be the only signs, right? There's a lot of inflammatory conditions or situations. So let's talk about inflammation because it's very important. What treats inflammation? Does Tylenol treat inflammation? That answer is no, it does not. Does Motrin or ibuprofen, Aleve, naproxen, etc., does that treat inflammation? That answer is yes. So the Motrin, ibuprofen, this side is an anti-inflammatory, where Tylenol is not an anti-inflammatory. They both do pain, they both do fever, but only the one, ibuprofen, does inflammation. Guys, that's really important for certain underlying conditions that you may have or need to treat, etc. So keep that in mind. That also may play a role into what your doctor recommends for you. Other thing I should say is that this conversation that I'm having with you, again, is not all inclusive. There's a lot more to tell you about this, but these are the highlights. This is also not intended for pregnant women, breastfeeding women, or children. I'm sticking to literally adults who are not pregnant or breastfeeding, okay? But once again, your doctor is going to be the one to tell you what you can do and what you can't do. Guys, let me know if this was helpful. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Write in the comments. Let me know if you take either medication. Oh, I should also say this is not an advertisement. This is not a sponsored video. Probably should have said that in the beginning. Not sponsored at all. I just think it's really, really important to tell people about this because as a family doctor, this is like my bread and butter. Okay. So yeah, just wanted to make that known. If you've not liked and followed my page, please do. For those of you who send stars, I respond to you personally. For those of you on YouTube, please subscribe to my channel, click the little bell for updates. And all of you guys, check out my website, drjencaudle.com. You can sign up for my free health newsletter and also my new offering called Dr. Jen's Daily Health Tips. Guys, I'm Dr. Jen. I'll see you soon.